Good afternoon, Peter Goertz. I'm a psychiatrist. The Psychiatric Interview. Here are a couple of tips that I can think of. The first issue is safety. Today, I was about to see a patient and I was reading his chart, and in the chart, it said that at one point the patient, out of the blue, without appearing unstable psychiatrically at the time, just assaulted someone, I think a staff member. So reading that before seeing the patient, of course, gave me some thoughts about how to potentially proceed with that patient. The first priority, like I'm alluding to, is safety. So you want to really do your best to make sure both you're safe and the patient is safe. So if you walk into a room and the patient looks like he's about to assault you, you want to do your best to walk right back out. The next thing I do is make sure I have the right patient. That can happen, unfortunately, also, that you go to interview a patient and then if you forget to ask the name and the date of birth, you realize a little bit down the road that that's not the correct patient. So you don't want that to happen. So you want to, if at all possible, have the patient state their name and their date of birth. Some patients aren't able to do that. They're obtunded. So you want to confirm the name and date of birth with the nurse or another staff member. Also, if you're doing a video interview, you want to ask the patient if there's another person, for example, a family member in the room, because you don't always see that person if you're interviewing a patient by a video. And what I like to do is interview the patient first. So have the visitor, let's say a family member, leave the room, interview the patient, and then you want to ask the patient before you contact any other person like the family member if it's okay with that patient to do so. So that's one of the first things I do, is make sure there's no other person in the room. Have that person, if they're there, leave the room, but ask the patient if it's okay for me to talk with that person or other people who know the patient after I speak with the patient. Another thing to do early is to make sure you're aware of the cognitive state of the patient. What's happened to me at times is I've been a little bit into the interview, like maybe even 5 minutes, maybe more into the interview, and then I realize that maybe the patient's demented, and I realize, unfortunately, that maybe everything they told me was not correct, not true, that they were just not remembering things correctly. So early on in the interview, you want to make sure you at least briefly evaluate the cognitive state of the patient so that you don't get into the interview and then after 5 minutes or more realize, oh my God, this patient is totally unreliable, they're cognitively impaired. So after all that, you're ready to start the actual interview. And the first thing I do, or early on, I like to make sure I know, is the patient suicidal? Is the patient homicidal? Are they hearing voices? Are they delusional? So those are some basic things I like to try and establish the answers for early on in the interview. And then you go through the basic schema, whatever schema you use for an interview: history of present illness, past psychiatric history. When you talk about the past psychiatric history, please don't forget to ask about mania. That can be counterintuitive if you're sitting in front of a patient who's quite depressed. It can be counterintuitive to think about the person being manic, but at times these people have been manic in the past if they have a diagnosis, for example, of bipolar disorder. So you don't want to miss that. That is one key thing to know for treatment down the road. You want to ask about past medical history, past surgical history. In women, you don't want to forget to ask about the wish to become pregnant or are they breastfeeding now? Because that can really influence your choice of medication for that patient. So again, you want to know, do they want to become pregnant in the near future? Are they currently breastfeeding? You want to not forget to ask about allergies. That can bite you if you forget that and then you recommend a medicine or prescribe a medicine and then realize down the road, oh my God, this person was allergic to that. You don't want to have that happen. You want to ask about their current medicines at home, what medications they're taking at home. And some people don't remember well, so that can be difficult to elicit the information regarding what medicines the patient's been taking at home, but you want to do your best and maybe get collateral information, let's say from a family member regarding that, or you may want to ask that a nurse call the patient's pharmacy and see which medicines were picked up recently. When you ask about the social history, things to really do your best to get into the habit of remembering are, you want to ask if the patient has children, underage children, so non-adult children at home, because you don't want to hospitalize a patient and then down the road realize, oh my God, there are minor children alone at home. Same type of thing with pets. You want to ask the patient, are there any pets at home that need care? Another basic issue to ask about is, does the patient have a gun? Because if they do, for example, if they're suicidal, you want to do your best to have family members remove that gun from the patient's possession, take it out of their home, for example. And then towards the end of the interview, you want to do, if necessary, a formal mental state exam. A lot of the things that you ask about during the interview can give you parts of the mental state exam, but if you need to, for example, ask the patient, what is your mood at this point? That's one thing you can do formally in the mental state exam. And I usually do that towards the end of the interview. Thank you.